So welcome back, my dear doctors. So today we are going to discuss the physiology recalls from INICET May 25. As we see, questions are repeated. If not questions, at least topics are repeated. So again and again, they are asking the same question. One question will be definitely from EEG. This time they asked, a patient is asked to close his eyes and then reopen them. Which of the following EEG wave show a decrease upon eye opening? So when your eyes are closed and your mind is relaxed, which wave is there? It is always alpha wave. We know that it is always which wave? Alpha wave. Alpha waves are there. So alpha wave is mainly seen when your eyes are closed and your mind is relaxed. And whenever you open your eyes, suddenly there will be a thought coming into your mind, and that is called as alpha block. So this is actually a phenomena of alpha block, which is asked in this question. Whenever you open your eyes, suddenly there will be a block, and this block is called as alpha block. Now, again and again, I'm giving you a mnemonic. With that mnemonic, you can solve almost every question which is related to EG, and that simple mnemonic is gamma bad dance. Frequency wise, if you see, maximum frequencies of gamma wave, then beta wave, then alpha. After alpha comes what? Alpha wave, and beta, alpha, theta, and then delta. So we can see here that gamma has maximum frequency, approximately 30 to 60 or sometimes 70 hertz. And gamma will be seen if you have very focused attention. It can be seen if we have very focused attention. Your attention is undiverted, as if you are solving some mathematics problem. So when you are busy, with your all those important problems, your mind is very focused. And if you do EG, what you will get? Gamma wave. Then beta. If you had beta, it become 13, like that, beta. So 13 to 30 hertz. 13 to 30 hertz, your mind is attentive, but not very focused. And of course, your eyes are open. So mind will be attentive and eyes will be open, like that. For example, you are seeing my lecture, your eyes are open, you are seeing my lecture, but suppose you are not very focused, which wave will be there? Beta. And suppose you are very much engrossed in my lecture, okay, when mind is very much engrossed in something, some problem, only then we will have gamma wave. So gamma, beta, alpha. Suppose in the lecture you start, you will say, okay, I will close my eyes and I will just listen to your lecture. Okay, so when you close your eyes are closed, frequency become less, 8 to 13 hertz, and mind is relaxed or wandering. Of course, when you close your eyes, thoughts start coming to your mind, but you're relaxed. Then in that condition, wave will be alpha wave. Alpha wave. They are like meditation. When you close your close your eyes, okay, there are a lot of thoughts coming and going like that. Your mind is wandering. In meditation, of course, the wave will be alpha wave. Don't think that thoughts will not come if you're meditating. Of course, even if eyes are closed, thought will come and thought will go. The purpose of meditation is that you should not attach to the thought. Of course, thoughts will come. It is not that thought will be absent during meditation. So when you close your eyes, thoughts are coming, but you are not thinking the thought. Okay, you are trying to avoid the thought. They are coming and going like a cloud. Which wave will be there? That is alpha wave. You will be relaxed. They are the best wave. And the condition when this can be increased are two. Alpha wave can be increased when there is hypoglycemia and hypothermia. Hypoglycemia and hypothermia. That is why those who are going to, meditation and all, the sages, they take usually very less food and they live in mountains. Why? Hypothermia. So when there is hypothermia, hypoglycemia, these low frequency alpha wave will be more. Mind will be relaxed. Anyway, now you are going in the NREM sleep stage 1. Wave will be theta. In the theta waves are characteristic of NREM stage 1 and frequency is less than 13, around you can say 4 to 7 hertz. 8 to 13 is alpha. These are 4 to 7 hertz. They are also called as memory waves because they are seen in hippocampus where short-term memory convert into long-term memory. And then delta wave, D for delta, D for deep sleep. Deep sleep, deep coma, organic brain disease, and frequency is the least, less than 4 hertz. So this is the basics of EEG wave, gamma, bad dance. Gamma being the maximum frequency, beta, alpha, theta, and delta. So we know that one question will be definitely asked from EEG, so please don't forget this. Question number 2. Fever during infection is regulated by, again, temperature regulation. Very favorite question of examiners. Answer will be preoptic nucleus. Preoptic nucleus. Now you might be thinking there is anterior nucleus, there is posterior nucleus. So why only preoptic nucleus is the answer? See, what are the nucleus of hypothalamus that have a role in the fever? The first nucleus is medial preoptic nucleus. It has thermoreceptor. It is thermoregulator and it is present in anterior hypothalamus. It is setting the baseline body temperature, the set point. Okay. And whenever there is more PGE2, again, this is again a question, PGE2, when it increases in the hypothalamus, it raises the set point causing the fever. And if there's a lesion of this nucleus, there will be impaired temperature regulation. Okay. So thermoreceptors are basically present in medial preoptic nucleus. And when there is infection, okay, I will show you how this will be happening. Okay, interleukin 1, interleukin 6, they will rise and they will enter in the hypothalamus, increasing PGE2. PGE2 prostaglandin is important to increase the set point, causing the fever. Then we have anterior hypothalamic nucleus and posterior. If you attended my previous lecture, I always say A for AC. So in which condition you will need AC, air condition? When temperature is high. So they respond to increased temperature. How? By causing sweating, promoting heat loss by causing sweating. Okay, by causing sweating. So if AC is not working, there will be hyperthermia. There will be hyperthermia when it is not working. Okay, and roll in fever, PGE2 overrides. It allows the fever. The fever is caused by preoptic, but it will be allowed by anterior hypothalamic nucleus. Posterior hypothalamic nucleus is like a heater. Why? It responds to cold. This responds to hot temperature. This responds to cold temperature. It promotes heat production by shivering, by producing the shivering. So shivering is produced. Shivering, vasoconstriction. Here sweating and vasodilation. Sweating and vasodilation is done when temperature is increased in the environment. Shivering and vasoconstriction will be there when temperature is less. It responds to cold. Okay. It becomes active to raise the temperature, and if there's a lesion of this, if heater is not working, there will be hypothermia lesion. So these are the three nucleus which are important for temperature regulation, but receptors will be there in the preoptic. So question was asked regarding fever during infection is regulated mainly by, answer will be preoptic nucleus. Now the fever, how fever come? So the simplified fever mechanism flow chart is, whenever there is infection, suppose you are having sore throat or anyone is having sore throat, or any other infection in the hand, whatever, there will be rise in interleukin 1, interleukin 6, TNF alpha, and this will cause increased prostaglandins. It is again very important question. Increase in the PGE2 in hypothalamus, which will act on medial preoptic nucleus to increase the thermostat set point, and posterior hypothalamus is activated. Shivering and vasoconstriction will cause fever. So anterior and posterior, they are activated with the help of thermoreceptor set point, and set point is in the preoptic nucleus, medial preoptic nucleus. Which one of the following pulses is based on Frank-Starling law? So very important question. It is pulses alternus, alternans. Alternating, you can see here, alternating pulse of high and low amplitude, again high and low. It is showing Frank-Starling law. So first let me revise what is Frank-Starling law. If you remember, a stroke volume or force of contraction is proportional to the end diastolic volume. Under physiological limit, end diastolic volume is actually the preload. What is the preload? Amount of blood in the heart before contraction. Amount of blood in the heart before contraction is called as preload or end diastolic volume. Amount of blood in the left ventricle after the diastole or before the contraction is called as end diastolic volume. So more is the preload, more will be the force of contraction. So more is the preload, more is going to be the force of contraction. This is called as Frank-Starling law. Under physiological limit, after that it will not be followed. This is very important. So you must remember that force of contraction is proportional to end diastolic volume. Now, whenever there is left ventricular failure, left ventricle will fail. So whenever there is failure of left ventricle, what will happen? Force of contraction will be less. So that will cause less amount of blood to go from ventricle in the aorta. So more blood will be in the ventricle after the contraction. So end diastolic volume will increase. Preload will increase because ventricle failure is there. Ventricles are not able to pump the blood in the aorta. And when ventricles are not able to pump the blood in the aorta, more and more blood will be, backlog will be there. Backlog will be there. And that will produce stretch on the ventricle, producing more force of contraction. So alternating, this will be weak pulse, that will be strong pulse. Weak pulse, strong pulse. So weak pulse will produce a backlog of blood in the left ventricle, producing more and more end diastolic volume, causing a stretch in the left ventricle, and that is going to increase force of contraction. So like that, first there will be weaker pulse, then will be the stronger pulse. It is called as pulsus alternans found in left ventricular failure, and this is proving what? Frank-Starling law. It is a conceptual question. Okay. Rapid ascent to high altitude leads to, again repeat MC. Sometimes they will ask you tetany, sometimes they will ask you respiratory alkalosis. Why? Because when we are rising, the high altitude, there will be decrease in the PO2, and this will be sensed by whom? Peripheral chemoreceptor. This will be sensed by peripheral chemoreceptors, and this will cause increase in the respiratory rate, causing carbon dioxide washout, causing respiratory alkalosis. It's a very simple thing. It's very simple thing, causing respiratory alkalosis. So answer is respiratory alkalosis. But one more thing need to be understood, because it is again asked again and again. Whenever there is alkalosis, actually proteins are most abundant buffer in the body, especially albumin. So albumin have site of attachment for both proton and proton as well as calcium. Whenever there is alkalosis, what do you think, my dear doctor? proton will be more or less. Proton become less. Proton become less. The site of attachment will be free for calcium. So more and more calcium will attach to the albumin. So free calcium become less. And whenever free calcium become less because of increased protein binding of calcium, this will cause tetany. It's very, very important. Tetany, it is famous whenever there is respiratory alkalosis. It is a famous question and that can cause carpopedal spasm. That can cause carpopedal spasm. You know, Clausius sign, Chostek sign. If you tap the facial nerve, okay, there will be contraction of facial muscle, the Chostek sign, and this is called as Clausius sign. There will be carpopedal spasm. So lots and lots of questions are asked from this particular concept. I hope this is clear. If you want more detail, you can go to chapter of calcium homeostasis, regulation of calcium metabolism. There's a chapter. It's a very, very important chapter. It will coordinate a lot of things. Now, what is seen in Bezold-Jarisch reflex? Bezold-Jarisch reflex is seen in the heart, of course, and it is seen by a lot of things like serotonin, phenylbutyrate. It is seen by capsaicin, viratidine. So there are a lot of stimulus like serotonin, phenylbutyrate, capsaicin, viratidine. These all will stimulate Bezold-Jarisch reflex in the heart. And what will be the response? Suppose if someone gives poison to the heart, what should be the purpose of heart? To shut down or to cause more and more heart rate so that it will be, it will go to the brain. Is it good or bad? Have you heard about Neelkant? Poison was there in the neck. It should not go down in the body. Okay. Just imagine heart has been instilled some poison. Now, if there is a tachycardia, more and more poison will go to the circulation. So heart does not want this. So everything will shut down. If you remember this, you need not mug up the findings. Everything will be shut down. Everything will come down. There will be decrease in the heart rate, bradycardia. There will be decrease in the blood pressure, hypotension. Even respiration will stop. But whenever you try to stop respiration, apnea followed by rapid breathing. Apnea followed by rapid respiratory rate. So it is a shutdown of the system. BP low, heart rate low, but because apnea will cause buildup of carbon dioxide, so it will bound to have hyperventilation. So no need to mug up. In Bezold-Jarisch reflex, or if they ask you about the J receptor in the lung, juxta pulmonary capillary receptor. It was discovered by Dr. Avtar Singh Paintal. He was from KGMC Lucknow. I'm from same college. So J receptor, juxta pulmonary capillary receptor, or even in vasovagal syncope, in all these three condition, answer will be same. Shut down. Everything will shut down. No need to mug up. BP low, heart rate low, but apnea followed by increased respiratory rate, because when there is apnea, there will be increased buildup of carbon dioxide. So chemoreceptors will be activated and those will cause hyperventilation. Otherwise, it will go down, isn't it? So this is about Bezold-Jarisch reflex. So hypotension is correct, bradycardia correct. Okay, apnea followed by rapid respiration. So it is bradypnea. So bradypnea is actually not absolutely correct. Tachycardia will be wrong. So actually answer will be 1 and 2. Some people are saying that it was not bradypnea, it was apnea followed by increase in the respiratory rate. Okay. So if this would have been the answer, then answer will be 1, 2, and 3. So BP will be less, respiratory rate will be less, and apnea followed by rapid respiratory rate. So in this condition, answer will be 1 and 2. If they have given apnea or respiratory rate will be increased, then answer will be 1, 2, and 3. But no tachycardia. No tachycardia. Is this clear? What is the tetanizing frequency if muscle contraction period is again 40 millisecond? Again, the same question. We know the formula of tetanizing frequency is 1 upon contraction period. So 1 upon 40 millisecond. So millisecond, it will come up 1000 upon 40. So answer will be 25 hertz. So answer is very easy. So see, this is the point of stimulus. It is called as latent period. It is called as contraction period. It is called as relaxation period. So answer, you know, it is 1 upon contraction phase. But you must know what is tetanus. Tetanus is the sustained contraction. Tetanus is a sustained contraction due to repeated stimulus. Due to repeated stimulus in contraction phase. So only see, if only this is the first stimulus, this is the second stimulus, this will be the third stimulus. If second stimulus lies in the contraction phase, only then there will be sustained contraction. So this frequency can increase only if it is coming in the phase of contraction. That is why formula of frequency will be what? 1 upon contraction phase. So tetanus, complete tetanus is the sustained contraction due to repeated stimulus when second stimulus falls in the phase of contraction. Is this clear? Only then it can produce complete tetanus. Otherwise, it will produce incomplete tetanus like this. It is incomplete tetanus, not complete tetanus. Clear? Which of the following is not a mechanism of action of ADH? ADH is again a very important topic. They ask you receptor. They are having 3 receptor, V1 in the blood vessel, V2 present in the principal cell of collecting duct, V3 is for release of ACTH from anterior pituitary. So V1, V2, V3 are acted upon by hormone ADH. Why V? Because ADH is also called as vasopressin. Vasopressin. It is important for maintaining medullary hyperosmolarity also via urea cycle, and also it reabsorbs water from collecting duct. Let us see what are the options. Increase absorption of urea in medullary collecting duct. Absolutely correct. Absolutely correct. Because medullary hyperosmolarity is a very important event, and 50% it is because of urea reabsorption from collecting duct in the presence of ADH, and other causes counter current multiplier. Okay, so medullary hyperosmolarity are important event in the kidney physiology. If there would have not been medullary hyperosmolarity, water cannot be reabsorbed or water will be lost and we will die. So medullary hyperosmolarity is an important event because more than 99% of water is absorbed from the kidney. GFR is 125 ml per minute and urine is only 1 ml per minute. So more than 99% of water is absorbed in the nephron, and this is only possible if we have medullary hyperosmolarity, and this is because of two events. One is urea cycle in the collecting duct, and other is counter current multiplier. So first option is correct. Increase absorption of urea in medullary collecting duct. Number two, increase absorption of urea in descending loop of Henle. No, it is absolutely wrong. Absolutely wrong. This will be the answer. Urea is secreted everywhere, but reabsorbed only at the late collecting duct because there are urea transporter. which are activated by ATH. Third, increases absorption of NaCl from thick ascending limb of lower family. Absolutely correct. How? By sodium potassium 2 chloride channel. And this phenomenon is called as counter current multiplier. More and more absorption of sodium chloride from TAL by NKCC. What is NKCC? Sodium potassium 2 chloride channel. It is called as counter current multiplier. Absolutely correct answer. Increases water permeability in collecting duct. Absolutely correct. Why? Because in the collecting duct, there are the principal cell, okay, and they have V2 receptor, which is acted upon by ADH, and it causes implantation of aquaporin 2. Aquaporin 2 is ADH dependent for water absorption. So these all points are very, very high yield. That is why I discussed this point. Next question, which of the following is an example of feed forward mechanism? Vasoconstriction on cooling of skin. On cooling of skin. Okay, good. Yes, true. Increase heart rate when standing up from supine position. So when you stand from supine position, baroreceptor will work. It is a feedback, not feed forward. Baroreceptor, baroreceptors will work because when we stand up, all blood will pool to the leg, and baroreceptor will work and cause increase in the heart rate. So this is the example of negative feedback, not feed forward. Feed forward when you work in anticipation, and the best example is temperature regulation. Okay. Increased vasopressin secretion during dehydration. No, again feedback. Increased cardiac output. So no, these all are feedback. Only one is feed forward, and that is temperature regulation, vasoconstriction on cooling of skin. So when there is cold temperature or when there is a cold environment, automatically there will be vasoconstriction and shivering. Just now we have discussed whenever there is decrease in the temperature of environment, okay, who will respond? Which nucleus? Anterior or posterior? Just now I have discussed posterior. Posterior hypothalamic nucleus will be acted upon, and there will be vasoconstriction and shivering even before our core temperature drops. So we are working in anticipation. So whenever something is done in anticipation, that is example of feed forward mechanism, not feedback. For example, you are doing MCQs before going to the lecture. Suppose you are going to attend a lecture, and before lecture you have done your MCQ. You have pre-planned that now I can understand what is wrong with me, why I cannot attend this question. It is feed forward. But after coming from the class, if you are doing your MCQ, it is feedback. Your teacher has asked to do MCQs after the class, then okay. Okay. Surface tension in alveoli is increased during. Surface tension is increased when we are doing inspiration, because when we are doing inspiration, surfactant which are closely located on the inner side of the alveoli will get dispersed, and that will produce a break. Okay. So surfactant concentration will decrease during inspiration, and that will produce a break. We can see from this diagram. During inflation, the alveolus has expanded from radius this to this, greatly reducing the surface density of surfactant. Thus, surface tension and elastic oil will rise, putting a brake on expansion. So, after certain time, it have to stop. On the other hand, during the radius of the alveolus has expanded from 100 to only 120, its surfactant is less diluted, putting less brake on the expansion. So when you are inspiring, when inspiration is going on, my dear doctor, okay, or when expiration is going on, what is the difference? When inspiration is going on, concentration of surfactant will decrease. They become sparse. And when this is your inspiration, this is your expiration, and when expiration is going to happen, it is coming closer and closer, and surface tension will decrease so that it can again expand. Here, surface tension will increase so that it should put a brake on expansion, it should come back. So lungs are going like this beautifully. The rhythm of respiration, the one of the role is of surfactant, dynamic compression. It is called as dynamic compression. So you must know during inspiration, surface tension will increase. Next question. In uncontrolled diabetes, in which of the following cells there is decreased glucose uptake due to insulin deficiency? You know, skeletal muscle and mainly skeletal muscle and adipose tissue. Skeletal muscle and adipocytes. Because blood glucose absorption from these tissue are dependent on GLUT4. GLUT4 is dependent on insulin. Insulin. So there is uncontrolled diabetes. So either insulin is less or it is not working properly because of insulin resistance. So decreased glucose uptake will be in the skeletal muscle and adipocytes. So mainly skeletal muscle, adipocytes, and the heart also, it is insulin dependent because of GLUT4. GLUT4. GLUT4 is insulin dependent. Okay. The hyponatremia in hypovolemic patient in case of severe diarrhea is due to hyponatremia and hypovolemia. It means there must be some dehydration. And in dehydration, if there is hyponatremia, what can be the cause? Decreased reabsorption of sodium from kidney? No. Decreased absorption of sodium from the gut can be there. Decreased secretion of aldosterone? No. Increased secretion of ADH? Yes. So whenever there is loss of water, whenever there is dehydration, automatically to compensate, ADH will increase. And ADH will act on principal cell. Okay. On the basolateral side, there is always aquaporin 3 and 4. 3 and 4. But aquaporin 2 is present inside the cell. It is present inside the cell. Only when ADH comes, this will implant aquaporin 2 on the luminal side so that water can be reabsorbed. Okay, so only water will be absorbed. And more water will be absorbed. It will produce dilutional hyponatremia. So this seems to be more appropriate answer for this question. The hyponatremia in hypovolemic patient in the case of severe diarrhea is due to increased secretion of ADH. The murmur of mitral stenosis correspond to which part of ECG? We know it is a mid-diastolic murmur with pre-systolic accentuation. If you remember, it is a mid-diastolic murmur, mid-diastolic murmur with mid-diastolic murmur with pre-systolic accentuation. Okay. So answer is obvious. It's very obvious, P wave, because when atria are contracting, ventricles will be relaxing. So answer is P wave. Let me see. So ventricular synchronization of atrial contraction with ventricular diastole. So during diastole, atria is contracting. P wave. So if there's a mid-diastolic murmur with pre-systolic accentuation, it will be around atrial contraction. So P will be the answer. So ventricular diastole starts after the T wave. It includes isovolumetric relaxation, passive filling, and atrial contraction. Atrial contraction occur in late diastole, correspond with the P wave on ECG. It helps in active filling of the ventricles. So in mitral stenosis, blood flow from left atria to left ventricle is impaired. Atrial contraction becomes very important to force blood through the narrowed mitral wave. Hence, murmur is accentuated just after P wave, called as pre-systolic accentuation. Mid-diastolic murmur with pre-systolic accentuation. So answer will be P wave. It was an easy question. The neural center responsible for explicit memory. Again, one more question from this table. Answer is hippocampus. We know this table. So many times, almost in every recall, I will discuss this table. Because everywhere, in every examination of INICET, NEET PG, this table have to be asked. So there are two types of memory. One is declarative. For example, if I ask you, do you remember your exam question? Yes, you can declare. Or if I ask you, what is your name? What is your place of birth? What is your date of birth? You can declare. So declare is declarative memory. It's also called as explicit memory. Other is non-declarative, which is in your subconscious mind. If I ask you, can you drive a car? Yes. Can you do lap chole surgery? Yes. So you have to show it. So that is in your subconscious memory. You have to show it. Declarative, you can declare. Now, that can be factual or that can be episodic. Some fact can be there. What is your name? Or how was your first day in medical college? Event, episodic. So, declarative or explicit can be of two types. It can be semantic or it can be episodic. And temporal cortex has very important role, especially hippocampus. So lateral anterior is for semantic and medial is for episodic, along with the hippocampus in the temporal cortex. That was asked. The answer will be hippocampus. Short-term memory converts into long-term memory in the hippocampus via neurotransmitter glutamate, via neurotransmitter glutamate acting on receptor NMDA. Okay, so when calcium enter inside the receptor, it will do a process, and that process is called as long-term potentiation. I hope you remember this process. I have discussed in detail in main video. Long-term potentiation. So it is long-term potentiation in the hippocampus, where short-term memory convert into long-term memory. It is called as long-term potentiation. In non-declarative memory or implicit memory, there are so many types, like procedural. If you learn some procedure, some skill, who is involved? Basal ganglion and cerebellum mainly. In basal ganglion, who is involved? Corpus striatum. Then priming and perceptual. When something is based on your previous memory. Suppose if I ask you, there was a question in PG, who discovered EEG, and the student was not able to answer, then examiner has given a hint. Okay, it has something to do with MACD. Then he said, okay, it is Hans Berger. So which type of memory it is? Answer was priming and perceptual. And the center is neocortex. Then we have associated learning, like the Pavlov dog experiment. Even by ringing the bell, dog starts salivating because his mind has associated ringing with the food. So Pavlov dog experiment or operant conditioning, these are linked with the amygdala and cerebellum, and then non-associative learning like habituation and sensitization understood by reflex pathway. So this table is again and again asked in your examination. So please understand this table thoroughly. Which of the following molecules is structurally most similar to IGF-1 and IGF-2? It is not, it is not insulin. It is pro-insulin. It is pro-insulin. Okay, how? See, the principal circulating somatomedins are insulin-like growth factor IGF-1, called as somatomedin C, and IGF-2. These factors are closely related to insulin, except that their C chains are not separated, just like proinsulin. Do you remember? The diagram of pre-pro and pro. Okay, this is pre-pro insulin. Pre-pro insulin. It is having a initial segment. It is having A chain. It is having B chain. It is having C chain. But here, initial segment is gone. Only we have A chain, B chain, and C chain. It is called as proinsulin. So it is not closer to the insulin, but proinsulin. Why? Because it is having C chain. C chains are not separated because in the insulin we have only A chain and B chain, and C peptides are separated. So just like proinsulin, IGF-1 and 2, C peptides are not separated. One thing, and second, they also have an extension of A chain called as D domain. It is not initial segment. They also have one more chain called as D domain. So IGF has A chain, B chain, C chain like proinsulin, as well as extension of A chain called as D chain or delta chain. Okay, D domain. So IGF is very important. This table is again very important. Growth hormone are doing so many actions, and they are called as direct action. Then growth hormone will act on liver to release IGF-1, somatomedian C, to do several other action. So almost most of the actions are similar, like protein synthesis and epiphyseal growth. These are similar, but few actions are opposite, like growth hormone having decreased insulin sensitivity. It is diabetogenic hormone. Growth hormone is diabetogenic hormone. Why? It causes hyperglycemia. That is why if someone is having acromegaly, it is called as pituitary diabetes. On the other hand, IGF is having insulin-like activity, anti-diabetic hormone. Number two, it causes lipolysis and it causes anti-lipolysis. One extra action is sodium retention. So please remember this table again from Ganong. Thanks a lot. All the very best.